Welcome back to the American College of Surgeons Bulletin Brief from the front lines, Surgeons' Voices. With me today is our chair-elect of the Committee on Trauma, Dr. Jeff Kerby. Dr. Kerby is the Brigham Family Endowed Chair of Surgery and Director of the Division of Trauma and Acute Care Surgery at the University of Alabama at Birmingham. Welcome, Dr. Kerby.
Thank you very much. Pleasure to be here.
Great to have you with us, and congratulations upon your very well-deserved election as the chair-elect of the COT. COT, of course, is one of the oldest of the college programs, soon to celebrate or currently celebrating a centenary. So maybe you can tell those of us who are not trauma surgeons a little bit about the workings of the COT and maybe a little bit about your background too.
It's a pleasure. I'm certainly very honored to have this opportunity to serve as the chair of the Committee on Trauma. As you mentioned, the Committee on Trauma has been with us for 100 years now, and we are celebrating the 100th anniversary this coming year. The Committee on Trauma has been with us for 100 years. It started as the Committee on Fractures, when Charles Scudder was the first chair of the Committee on Fractures, and then it evolved over time to become what it currently is, which is the Committee on Trauma. Our vision for the Committee on Trauma is to eliminate preventable death and disability across the globe by preventing injury and improving trauma outcomes from injury. And there are several programs within the Committee on Trauma. It's not just a committee, it is a committees of trauma. There are several committees within the committee that focus on different areas for trauma care. We have 4 pillars in quality, in trauma systems, and education, as well as in injury prevention and advocacy that all focus on different aspects of trauma care and trying to see our vision through and move the COT mission forward.
The COT is a program that is obviously well established in its century of existence. Perhaps you could share with us the scope of COT activities, perhaps first in North America, just telling us a little bit about what types of programs there are, and more or less how many centers might be involved in being accredited by the COT.
Yeah, we can start with our quality programs. Our quality mission has really evolved over the last 40 years. In the late 70s, early 80s, we started a trauma consultation program for trauma centers, which evolved into a verification program, which was approved in 1986. We currently have over 500 centers across North America, which are verified by the American College of Surgeons Committee on Trauma. We also have a trauma quality improvement program. This is our benchmarking program, and we have over 800 centers that submit data to the TQIP program, and this really provides a comparison for trauma centers and how their outcomes are compared to other centers across North America, and really helps us focus our quality efforts at those individual centers when you're looking at your benchmarking. Quality is really a core program and a focus of what we do. Education is also a big part of what we do, and really the anchor for educational programs is Advanced Trauma Life Support. This is an educational program which has been with us since the early 80s and has expanded internationally. So there's a lot of Advanced Trauma Life Support education that happens in an international realm as well. And this has really been a way for us to expand the COT influence outside of North America through this educational portfolio that we have. The Advanced Trauma Life Support is continuing to evolve. This year, we'll start revisions on Advanced Trauma Life Support. This will be our 11th edition. With that, we're working on some different platforms for the ATLS education, trying to promulgate this into other areas where maybe low resource areas, really trying to push this out to as many learners as we can to improve trauma care, consistent with our vision across the globe.
You've mentioned a few times there, international and across the globe. I'd like you to expand on that theme for us, because an increasing number of international surgeons each year apply for and are successful in obtaining fellowship. We have more and more international initiates. We're almost at 50% the last few years. So what is the degree of international engagement, whether it's becoming ATLS certified, having a program certified, entering data in the registry, or being able to harvest data from the registry?
Certainly, the educational effort was really the first program that was propagated internationally. The COT is divided into different regions. We have 13 regions in North America, and to include a military region. And then we have 4 international regions throughout the world. We're also beginning to expand into some trauma system consultation internationally. There are regions and countries that are looking at developing trauma systems and have asked our help with that effort to begin that. And certainly we're beginning a consultative effort. They're also looking at our verification system and trying to replicate that in their individual countries. So what we're trying to do is provide support, guidance, and consultation for these other countries as they look to improve their trauma quality as well.
Great. One of the other things you touched upon is that you're working on the new edition, of course, and that's for this coming year. What are some of the other initiatives? Certainly the trauma programs have had some incredible successes lately, especially, of course, the Stop the Bleed program, which is absolutely landmark paradigm shifting program. You know, the hallmark, I think, of a great invention or innovation is when you say, wow, that wasn't around before. That's amazing. How did we do without it? And you know, and that program really hits that mark, which of course gives you big shoes to fill. But what are some of the agenda items in your docket for your term as chair?
Part of the work for myself will be to continue some of the great programs that the current chair, Eileen Bolger, and the trauma medical director, Ronnie Stewart, have started during their tenures with the college. They've certainly set a high mark for excellence in what they've been able to achieve and what they've done. I think for the next 4 years, our focus is really going to be on developing a national trauma emergency preparedness system, trying to get some federal funding for trauma systems so that we can continue to expand our systems, make sure that if someone's injured, that they have immediate access to high quality trauma care. And currently there are areas of the country where that just doesn't exist. There are trauma deserts, there are gaps in our system that need to be addressed. Some of what we learned from the pandemic has informed our discussions around the further development of trauma systems. There's a lot of interest in regional medical operations centers to try and provide that pre-hospital care coordination of trauma care that is not only for disasters or mass casualty events, but day-to-day trauma care as well. Part of our big effort over the next 4 years is advocacy for and development of a national trauma system or a national trauma emergency preparedness system. That's probably the number one initiative that we'll be working on over the next 4 years.
Great. I appreciate hearing about those initiatives, and I'm sure you're going to be successful. So we touched a bit on international, and another constituency we represent, of course, is RAS. What are some of the opportunities for residents and fellows, I suppose, in the trauma programs?
A big part of what we try to do is to develop the future trauma leaders that are going to be leading our trauma programs in the future. We have what's called a Future Trauma Leaders Program. It's a mentoring program within the COT. It gives an early career experience for trauma surgeons within 5 years of finishing their fellowship training. Typically, it takes a little time to work your way onto the Committee on Trauma during your career, but we're trying to give those early career experiences. We have a liaison position for RAS member. It's a 2-year appointment where they're able to participate in the COT meetings and in some of the COT projects. We also have a Young Fellows Association liaison member. That's a part of our Mentoring for Excellence in Trauma Surgery program. And this was developed by Dr. Bolger when she was a membership chair of the Committee on Trauma. And we have grown this experience. We, 2 years ago, set a goal, a very aggressive goal, to raise $1 million prior to the 100th anniversary of the Committee on Trauma to support our Future Trauma Leaders program. And I'm happy to say that it looks like we're going to achieve our goal. So hopefully we'll be able to expand our mentoring and early career experience opportunities for young trauma surgeons who have an interest in the COT.
Well, the degree to which you're involving residents sounds like you're surely going to ensure future leaders and future trauma surgeons to be very engaged with the college, helping patients throughout the country and throughout the world. I thank you for all of your insights today, highly informative, and you've got big shoes to fill, but it sounds like you're ready to tie them up tight and get off running as soon as you take over the reins of the committee. I congratulate you again upon that appointment and look forward to watching your successes.
Well, I appreciate that. We have a fantastic leadership team within the COT. We have fantastic staff partners at the American College of Surgeons Committee on Trauma. We are very excited about the opportunity and the future for trauma care in the country.